Hello everyone. Our work is AI-enabled pregnancy risk monitoring, prediction, a review. In this particular work, we reviewed more than 50 papers based on pregnancy risk monitoring, where various AI-enabled machine learning applications or AI-enabled techniques were adopted. Accessibility to antenatal healthcare service remains a critical challenge in rural India. According to a recent survey, the mortality ratio of pregnant mothers is 113 for each 100,000 live births from 2016 to 2018 period. Proper follow-ups and patient-specific lifestyle changes are required to get rid of many complications in pregnancy. Due to lack of qualified professionals, non-uniform accessibility of facilities, and affordability of expenses, the majority of people are not receiving proper medical care. AI-enabled remote monitoring systems improve patient-centered access to quality services and guidance for proactive self-management. In this paper, we review various AI and machine learning techniques applied for remote pregnancy monitoring and risk prediction. Pregnancy is a physiological process of developing a fetus inside a female body, a time period from conception to birth. Clinicians differentiate a pregnancy in which maternal and or fetal health, where complications are likely to occur during gestation or childbirth, by using the term high risk pregnancy. This risk may be due to several reasons, such as gestational diabetes or preeclampsia. Prenatal care may assist women in avoiding difficulties and educating them on how to protect their kid and ensure a healthy pregnancy. Women who receive regular prenatal care are less likely to have pregnancy complications. Following a healthy and balanced diet, exercising regularly as prescribed by the doctor, and avoiding contact of harmful chemicals, radiations can help reduce the risk of pregnancy. Pre-existing disorders like high blood pressure, diabetes must be managed carefully in order to avoid serious complications and its consequences. So, in pregnancy, if we consider about pregnancy risk, it may mainly involve preterm labor, preeclampsia, gestational diabetes mellitus, ectopic pregnancy, depression, anxieties, or maybe infections. Based on a comprehensive review of literature, we observed that the majority of research in this domain focuses on classification of fetal health and the prediction of preterm birth. Supervised learning, unsupervised learning, neural networks, genetic algorithms, and deep learning techniques were widely used to monitor and predict maternal risks. Supervised machine learning uses labeled dataset to train algorithms which classify data or predict outcomes. Several supervised approaches such as logistic regression, k-nearest neighbor, support vector machine, XGBoost, and decision trees were proposed for diagnosis and prediction related to pregnancy. The major risk factors predicted using these techniques are fetal health status, preterm delivery, miscarriage, ectopic pregnancy, preeclampsia, impact of dietary intake, and relation between exposure to particulate matter 10 with congenital heart disease. So, in a particular work where fetal health risk prediction was done, authors proposed a three-step classification approach to classify the fetal health into normal, suspicious, and pathological based on cardiotocography data set. In the first phase, latent class analysis was utilized to estimate posterior probabilities of individual records, and later maximum posterior probability is used to determine the fetal health status. The LCA method was combined with logistic regression approach in two different schemes, an ordinal classification and a multi-class classification scheme. In another work, a mobile application system which monitors and performs prognosis of remote patients seeking clinical treatment was proposed. A clinical dataset of 96 pregnant women was trained using two-class decision forest algorithm, and fetal health status is predicted with an accuracy of 89.5%. When the model applied to real-life testing with 16 users, accuracy reported was 87.5%. The second one, where preterm delivery was predicted, another group of work. For the prediction of preterm delivery, authors considered different classifiers which included linear discriminant classifier, quadratic classifier, uncorrelated normal density based classifier, logistic regression, KNN, For the study, they utilized an open source Physionet term preterm EHD dataset containing 300 records, which included 38 preterm and 262 term deliveries. The minority preterm class was oversampled by using synthetic minority oversampling technique, whereas different cross-validation methods were explored to evaluate the dataset against other similar studies. Using the polynomial classifier, the technique outperformed with 96% sensitivity, 90% specificity, and 95% area under the curve. In another work, a comparative study on the performance of 8 different machine learning techniques were done on UCI CTG dataset. Authors compared artificial neural network, support vector machine, KNN, random forest, and so on. The goal of this machine learning approaches was to categorize the fetal health into pathological and normal, utilizing features of data received from uterine contraction and fetal heart rate signals. The dataset comprised 1,831 instances with 21 features and obtained a maximum accuracy of 99.2%. Then another factor which was predicted was miscarriage. One of the most extensively used multifunctional imaging technique for monitoring and identifying early pregnancy event is ultrasound imaging. The gestational sac, which is earliest symptom and quantifiable aspect of early pregnancy, is assessed manually using ultrasound imaging normally. And in a particular work, authors use 6 ML algorithms to predict pregnancy loss risk after in vitro fertilization embryo transfer. They analyzed 66,706 records of data collected from transvaginal scans during the first trimester of pregnancy and achieved high predictive accuracy for the random forest classifier. While in a particular work, preeclampsia was predicted and the preeclampsia after 34 weeks of pregnancy using different machine learning models such as stochastic gradient descent, logistic regression, and so on. And in that particular study, stochastic gradient boosting model was confirmed to give the best prediction performance with an accuracy of 0.973 and false positive rate of 0.009 on the electronic medical record of 11,006 pregnant women who received prenatal care at a particular hospital. The parameters included the prediction models the parameters included in the prediction models were chosen using pattern recognition and cluster analysis. Same in the ectopic pregnancy was also predicted in a particular work where authors proposed a decision support system which helps the clinicians to decide initial treatment to be followed for ectopic pregnancy. Algorithms like a multi-layer perceptron support vector machine and also on and an ensemble of 3-stage classifier to decide a better treatment was adopted there. In a particular work, impactive dietary intake was monitored or predicted. In such a study, explored the relationship between dietary intake and adverse pregnancy outcomes, where authors took data of 7,572 women from another study. A food frequency questionnaire was used to assess the average daily prenatal consumption of total fruits and vegetables using multivariable logistic regression and superlearner with targeted maximum likelihood estimation. Authors computed the marginal risk of preterm delivery, preeclampsia, small of gestation age, and gestational diabetes. In another study, the relation between particulate matter 10 and risk of congenital heart disease was studied. Authors employed machine learning techniques models to study nonlinear effect of PM10 exposure to risk of congenital heart disease throughout a key time window of weeks 3 to 8 in pregnancy. Dataset includes 39,053 live-born children in Beijing with features maternal nation, gestation age, and so on. Similarly, we reviewed on unsupervised papers related to unsupervised learning and unsupervised learning such as dimensionality reduction, clustering, association rule mining were utilized to classify fetal heart rate tracing, fetal heart status, predict miscarriage, and even preeclampsia. So here clustering is one of the primary supervised learning method used in maternal data. Different types of clustering techniques have been successfully applied to categorize the pregnancy outcomes. For example, a real-time miscarriage prediction using big data was proposed where k-means clustering was used, while in another comparative study on different clustering algorithms for real-time miscarriage prediction was proposed. The data was collected using wearable sensors and mobile applications in every 60 seconds. Around 100,000 documents with 15 attributes were used for that particular study. K-means clustering, bisecting k-means, Gaussian mixture were adopted and reported that k-means and bisecting k-means were more efficient. In another study, a multi-channel approach where electromyograph signals were recorded, and they used for random forest for classification, k-means for clustering, and association rules on synthetic data set, which gave a performance accuracy of 80% classification of healthy and risky pregnancy. In another work, a clustering of 3,601 uterine contractions based on electrohysterography was performed, where hierarchical clustering and partition methods such as k-means and k-medoid clustering was evaluated. Next, unsupervised technique which was adopted for maternal care was dimensionality reduction. Since many of the data sets used for maternal monitoring include several clinical features, it is important to identify parameters that are most relevant to a predictive task and visualization. Linear and non-linear methods are used as pre-processing step in a system that predicts the risk of pregnancy. A self-organizing multi-layer neural network is proposed in a particular work to predict preterm birth using open data set with 38 preterm birth and 262 normal birth examples. Artificial neural network and backpropagation algorithm is applied in that particular work. A network design with 17 input layers, 50 hidden layers, and 5 output layers was adopted for classification task. Data classification system using an artificial neural network on a particular data set was found to enhance the performance by classifying pathogenic and normal class with an unexpected poor result for the suspicious case. Genetic algorithm was also applied in maternal healthcare in certain studies. In a particular study, author proposed ensemble machine learning model based on genetic algorithm to predict fetal weight at different gestational age. The authors used a data set with 4,212 samples where a cubic spline was used to fit the data extracted from ultrasound reports. Ensemble model consisted of random forest, XGBoost, light GBM algorithms were also used to train the model. In another work, a neuro-fuzzy-based genetic algorithm was proposed. It was proposed to differentiate the fetus growth as abnormal and normal. The method achieved an accuracy of 97%. Deep learning technique. Recently, deep learning methods are widely applied in medical image analysis because of their improved performance in a very large data set. Since the most commonly used convolution neural network approach can automatically extract features without any human intervention, it preferred over conventional machine learning algorithms. So, for instance, in a particular work, authors developed a model to differentiate and classify the existence or non-existence of multi-class morphological patterns. An accuracy of 88.2 and a score of 0.8508 in average was received by model on CTG dataset. While in another work, an encoder-decoder based convolution neural network named Fetal Net for simultaneous segmentation and classification was proposed by the authors. Further, a pregnancy outcome prediction in case of patient with a history of recurrent reproductive failure was done using deep learning in a particular work. The electronic medical record of 561 patients was the input to an iterative shrinkage and threshold algorithm with coordinate descent. With relevant tannage function were used in hidden layer, softmax aided the output layer. In this study, a model was developed for prediction of pregnancy outcome at any gestational period. The accuracy ranged from 54.2 to 89.7 for each stage in testing data. In another study where deep learning was utilized, a deep learning regression model was used for fetal MRI as input and predicted gestational age. Convolutional neural network model based on weight voting mechanism, which classified the fetal heart rate as normal or pathological rate state, was proposed in another work. Fetal hypoxia is a serious condition which was also predicted by using a particular work where the work was done on CTU UHB open database and resulted in 0.9 area under the curve. So, in this paper, we presented a summary of different machine learning techniques applied in pregnancy risk prediction. Continuous monitoring and pregnancy outcome prediction frameworks provide high quality healthcare for women in the prevention of complications related to pregnancy. These models utilize either historical or real-time data from the patients and to generate the prediction models. The system acts as an individual self-management system that seamlessly performs the prognosis and recommends the required type of exercise, nutrition intake, and clinical support. So these are the various data sources which were adopted in this in the works which was explained earlier. So that is the end of this review paper. Thank you.